So hello everyone, welcome to my another video. So let's discuss about non-depolarizing muscle relaxants. So under the non-depolarizing muscle relaxant section, we have the three classes, that is long acting, intermediate acting and short acting. So under long acting class, there are three types of muscle relaxants: pancuronium, doxycuronium and pipecuronium. In the intermediate section, we have atracurium, rocuronium, vecuronium and cis-atracurium. Under the short acting section, we have mivacurium. So note these points and let's look at the other points too. So now let's look at the mechanism of action. So the non-depolarizing muscle relaxants act with post-junctional receptor membranes without causing activation of ion receptor channels. At high doses, they act by blocking ion receptor channels, and total block occurs only when 80 to 90% of channels are blocked, thus confirming wide margin of safety. I repeat, under the mechanism of action, the non-depolarizing muscle relaxants act with post-junctional receptor membranes without causing activation of ion receptor channels. At high doses, they act by blocking ion receptor channels, and the total block occurs only when 80 to 90% of channels are blocked, thus confirming wide margin of safety. I hope it is clear. Now let's look at the characteristics. So it decreases twitch response to single stimulus. The TOF ratio is lesser than 0.7. There are post-tetanic potentiation, unsustained response during continuous stimulation. This is the most important section from the exam point of view. Questions can be asked from this section. So I repeat, they decrease twitch response to single stimulus. There is unsustained response during continuous stimulation. The TOF ratio is lesser than 0.7 and there is post-tetanic potentiation along with potentiation of other non-depolarizing muscle relaxants. And the most important point is that there is antagonism by anticholinesterase drugs. I already mentioned that there is antagonism by the anticholinesterase drugs, and you can see this point over here, that potentiation of other non-depolarizing muscle relaxants are also there. So I already mentioned these points earlier. So now let's look at the systemic effects. So at the first column I have mentioned about the muscle relaxant, the drug. At the second column I have mentioned about the histamine release. At the third column I have mentioned about cardiac muscarinic receptors effects, and at the last column I have mentioned about the effect on the cardiac nicotinic receptors. So let's look at them one by one. So the muscle relaxant succinylcholine, it has modest histamine release and moderate stimulation of cardiac muscarinic receptors, and there is also moderate stimulation of the cardiac nicotinic receptors. I repeat, scoline has modest histamine release, moderate stimulation of cardiac muscarinic receptors as well as moderate stimulation in the cardiac nicotinic receptors. The second muscle relaxant, pancuronium, there is no histamine release, but there is moderate blocking in the cardiac muscarinic receptors. I repeat, in pancuronium, there is no histamine release or cardiac nicotinic receptors effect, but there is moderate blocking of the cardiac muscarinic receptors. The third muscle relaxant, doxycuronium, there is no histamine release, there is no cardiac muscarinic receptors effects, and there is no effect in the cardiac nicotinic receptors either. From this table, you can easily point out that pipecuronium, vancuronium, rocuronium, and cis-atracurium, these all drugs don't have any effect on the histamine release or the cardiac muscarinic receptors or the cardiac nicotinic receptors. And this atracurium drug only have the modest effect on the histamine release. Then let's look at the mivacurium. It also has the modest action on the histamine release. So Please go through this table for once. Now, the second point of the systemic effects section, that skeletal muscle weaknesses are there on recovery from the prolonged block. Under the drug interaction section, the volatile anesthetics enhance the duration and magnitude of block when used concomitantly with skeletal muscle relaxants. You already know about this. I already mentioned about that in the earlier lecture too. I repeat that volatile anesthetics, when they are used concomitantly with the skeletal muscle relaxants, they enhance the duration and magnitude of block. So let's look at the order of the volatile anesthetics in which they uh, show their action, in which they show the action of enhancement of the duration of the block. So at first enflurane, then isoflurane, followed by desflurane, then sevoflurane, halothane, and then nitrous oxide. Please mark this order of the volatile anesthetics in which they cause the effect. From the antibiotic section, aminoglycosides do enhance block duration, and the small doses of local anesthetics enhance block, while the larger doses can block neuromuscular transmission. Then the dysarrhythmic drugs, IV means intravenous lignocaine augments pre-existing block. I repeat, intravenous lignocaine augments pre-existing block. Then comes the diuretic section. Large doses of Lasix, that is the diuretic drug, at the dose of 1 mg per kg antagonizes block, whereas chronic hypokalemia decreases dose requirement of diuretics. I repeat, the large doses of diuretic tablet Lasix at the dose of 1 mg per kg antagonizes block, whereas chronic hypokalemia decrease dose requirement of diuretics. Please note this point. MCQs can be asked from this section. Then comes magnesium. Magnesium enhances the block. You already know that. Then comes lithium. Psychiatric treatment enhances block because psychiatric drugs do contain lithium, isn't it? You already know that. So it causes anticonvulsant resistance to neuromuscular blocking agents in case of phenytoin. Then comes hypothermia. So what happens is that if the patient is undergoing long duration of surgery in case of neurosurgeries or heart surgeries, then it prolongs the duration of block. Now, hypokalemia decreases the effects of non-depolarizing agents. We already looked at that point. And hyperkalemia increases effects of non-depolarizing agents. I repeat, hypokalemia decreases the effects of non-depolarizing agents, whereas hyperkalemia increases effects of non-depolarizing agents. I hope the concepts are clear. Now we'll be looking at other drugs too in the next lecture. So it was the second lecture from the section of the neuromuscular blocking drugs from the Anaesthesia Pharmacology section. So I hope you enjoyed this video. If you liked my content, please do share. And if you are new to my channel, please subscribe to it. Keep watching, keep learning.